There's a number of different types of e-mental health systems and technologies. Now, one part is connecting the patient or the client who is looking for help with a real therapist using technology. And this can be done either through video conferencing or audio conferencing, or even asynchronously through email or other kinds of chat. So the idea being that there's a therapeutic behavioral intervention going on, but that the patient doesn't need to be in the same place as the clinician, and not even necessarily being involved at the same time. This is a great way to disseminate evidence-based treatments broadly to people who are living in remote areas, or who, for whatever reason, don't want to come in to see a therapist or don't have the resources to do so. There's other possible types of e-mental health, which are these automated therapies, where essentially we're taking the best practices. What would a master clinician who's an expert in some treatment, whether it's for alcohol abuse or for depression or for anxiety, what would that person try to deliver one-on-one, and then have the computer actually provide that resource. And these can be combined. The online coach could work with the person who's also using an automated therapy. And there's also the potential, which I think is huge, for cell phone apps, smartphone apps that deliver a range of services, from monitoring the person to help them to track their own mood or their own symptoms and their own recovery from problems, to cell phone apps that actually provide some level of intervention. You know, a smartphone app is so nice because you can have it with you in whatever environment, and often behavioral health problems are very environmentally kind of context dependent. The person who's recovering from substance abuse, there may be certain places in the neighborhood that are very strong triggers for that person, places where they would have used drugs before, for example, or bars where they might have gotten drunk. So this smartphone app can use geolocation along with some therapeutic modality to really enhance the treatment experience. And then there's assessment tools that can be delivered either through computer or through smartphone apps. The idea of assessing either what kind of problem does the person have, or how severe is the problem, or actually helping clinicians do some decision making. So through algorithm-based, making recommendations to the clinician about what might be helpful for this person. The idea here is to provide a range of tools to the patients and to the clinicians and to everybody else in the system. There's many stakeholders in the system that's caring for people with mental health problems. It's not just the patient and the clinician, it's who's paying for it. This might be the insurance company or the government. It's other family members oftentimes. It can be employers. All these people and all these entities want to see this person get better. And they all can use different kind of resources provided technologically to do that. So I think that this is a huge wave of the future. I think that this is the way that behavioral health is moving. We can use technology to deliver training to clinicians, to monitor the clinician's effectiveness, and to provide them feedback to how they can actually improve in their therapy and their prescriptive abilities. So I hope that this field is growing, and it's certainly growing here in Boston, and encourage growth in the field outside of Boston as well.
Great.